MCQ question number 1. The client is being evaluated for possible acute leukemia. Which inquiry by the nurse is most important? A. Have you noticed a change in sleeping habits recently? Have you had a respiratory infection in the last 6 months? C. Have you lost weight recently? And D. Have you noticed changes in your alertness? What's your answer? The correct answer for this question is B. Have you had a respiratory infection in the last 6 months? But why do we choose B? What's the rationale behind it? So this client is being evaluated for possible acute leukemia. So leukemia is a condition whereby the bone that affects the bone marrow, whereby the bone marrow is not able to, the bone marrow produces abnormal white blood cells. And we all know white blood cells are our body's soldiers. Yes, like a city whereby the soldiers protect that city from invaders. That's the function of the white blood cells. They protect our body from pathogens, foreign bodies, and other things. So when these cells are abnormal, they are unable to perform accurately or as expected. So what could happen? The immunity will be low. That's why we chose B. So since the immunity is low, infection is possible to set in due to the low immunity. So that's why I chose B as the answer. Question number 2. Question 2 says, a client who is newly diagnosed with asthma comes to the clinic for evaluation. The nurse needs to notify the doctor when the client says, A. I have difficulty breathing at night. B. I make sure that I attend my baseball practice. C. I have been diagnosed to have juvenile rheumatoid arthritis. And D. I know this condition may affect my activities. What's your answer? The correct answer for this question is A. I have difficulty breathing at night. So this client, newly diagnosed with asthma, comes to clinic for evaluation. So we did not choose B because B, baseball practice is an activity that does not really create an issue with the patient or a client that has asthma. So it's still okay. So then D, I know this condition may affect my activities. Yes, that is also good for a patient with asthma to know that his activities will need to change due to this asthma. So C, I have been diagnosed to have juvenile rheumatoid arthritis. So there can only be an issue or a concern on this option if the medications that the patient will be taking or he already taking involves like aspirin. So aspirin is a drug or analgesic that has that could have a huge effect on a patient with asthma. But though aspirin is normal a first-line medication for juvenile rheumatoid arthritis. So, but for this situation, we have to attend to A first. I have difficulty breathing at night, which is orthopnea. Now, the last question. Where is the best site for examining for the presence of petechiae in an African American client? A. The abdomen, B. The thorax, C. The earlobes, and D. The soles of the feet. What's your answer? Do also let me know in the comments and why you choose that option as your answer. That means you need to give me a rationale. Also, let me know, what is petechiae? Tell me all this in the comments section and I will do well to reply you. Also do well to like, do well to share, do well to comment, and most importantly, do well to follow for more. See you soon.